Yes, good morning, good afternoon, good evening, wherever you're watching this podcast from. Neuroplasticity is much talked about in the first 1,000 days of life. It's very, very important that we should incorporate neuroplasticity as the basis for many majority of the disorders and behaviors, particularly in the first 1,000 days. Today, we are going to dedicate upon normal newborn behaviors, preparation by the parents for these normal behaviors, not to interpret them as abnormal, and understand it does take adaptation time for the infant to live outside the mother's womb. Majority of the times pregnancy is not planned in many instances, and then medical care sometimes in the developing countries or from the villagers because of the economic reasons, transportation reasons, they do not get to a facility where some education is provided. Busy doctor's life prevents any prenatal visits from going into the depths of neuroplasticity and how to really support and nurture in the best way in a safe, secure environment through the responsive caregiving, early relational health, which started actually in pregnancy. So, going through the first step from the conception of 23X and 23X or Y from the male partner, the cells multiply ultimately to become a fetus by fourth month of pregnancy, 12th week of pregnancy, actually, when the heartbeat starts. And by 4.5 months, most of the organ formation has happened, and the brain has moved from the lower end or the caudal end of the infant to the cranium. And then there will be differentiation of the organs into various systems, and most of the function, nutrition, everything has been going in directly from the placenta through the umbilical cord into the blood of the fetus. And based upon the infection control, B10, B12 deficiency control, mother can take care of those aspects as well as the infection aspects with all the vaccinations we have, including the tetanus and diphtheria protection is happening by 26 weeks. We are giving the Tdap to every mother. Excuse me. And we are also cocooning the adult caregivers to have their Tdap as they handle the infant. So we have cut down so much of infection proneness, even by looking for the group B strep colonization and giving IV ampicillin at the time of delivery if the mom did have group B strep in the vaginal and cervical cultures. Herpes has been under control, sexually transmitted diseases have been under control, and viral infections that randomly occur, that like COVID, we don't know, that's something. But infection protection has been much better than in the 1950s to 2000, the millennium. After that, the vitamin deficiencies have been covered, B10, B12, that can cause neural tube defects and so on. But what is more important is, one in four women have undergone physical or emotional abuse. And that leads to a state of depression, emotional stress, drain, and no emotional balancing techniques like breathing exercises, seeking therapy, or being able to express their own emotions. That can cause epigenetic factors to express a risk gene for neurodiversity. That includes autism, ADHD, and chromosomal microarray disturbances. But if nutrition is good, if emotional stress is prevented, there is a reasonable amount of spirituality, and not watching violent movies that have violence, and there is no high arousal of hypopituitary, hypothalamic adrenal axis, HPA axis, in other words. And if there is a control on surges of cortisol, epinephrine, or adrenaline, or norepinephrine, the fetal brain is protected. But we also know, although the infant is hearing and feeling the emotions of the mother inside the womb, the infant is exposed to environment after birth, and those experiences have a major role in creating the structure of the brain and the function of the brain. In the prenatal visit, if the parents expect that we are going to have our love in our hands, we want to do the best we can, we are the best parents, but then find it very fatigued because they cannot sleep through the night for almost about 10 weeks. That does drain them. And there is, in addition, postpartum depression by the mother, because there is a sudden drop in the hormonal balances, and some women cannot cope up with such a drop. And if the vulnerability and risk factors exist with the intimate partner violence, or emotional deprivation, lack of freedom, rigidity, problems with the relationships within the family members, the woman may go through furthermore aspect of depression, which is unnoticed because everything is masked up with being very calm and quiet, but at the same time, um, interaction with the infant can be suffering. So this is a red flag for all future parents who need to be mentally, emotionally be prepared to give emotional support, have emotional support, depend upon some resourceful adult individuals, understand about a bunch about neuroplasticity with the experience expectant connectivity that happens in the first 1,000 days of life, out of which most of the brain connectivity from outside to inside is happening in the first year of life. And it is interpersonal relationship that is very, very important. And in all of this, parents need to be prepared for a certain phase of the adaptation by the infant to live outside the womb. Imagine the infant being in a dark cave, floating in a warm saline mother's temperature, listening to the loved up sounds of the mother's rhythmicity of her heartbeats, listening to the sounds that they catch up as the story is read to them. There is an organization, there is a structure, there is a pattern that the infant is used to. And getting all the food directly into the bloodstream, swallowing the liquor and excreting it back into the liquor, amniotic fluid, and breathing the same amniotic fluid that suddenly becomes expressed out with the first cry and is sent out through the vacuum created from coming from inside the uterus with the pressure as they come outside with the first cry. The fluid is sent back into the circulation, and the infant does sometimes have a wet lung syndrome where they did not get rid of all of the water, and they breathe rapidly and they're observed for about 24 hours, and then they settle down. They're pink, alert, and doing everything. Then crying is very welcome at that time, because the more the infant cries, the more the fluid is pushed back into the circulation. And then this infant who has a stomach capacity of 15 ml has to learn to root, suck, and swallow. That does take time for the infant to understand how to get the milk from the mother. And mother produces only colostrum, and it is an first experience also between the mother and the infant, particularly for the firstborn child. The areola should not be inverted. Areola should have been pushed out by between 37 to 40 weeks till the time of the delivery, massaged. And so, if there is no inverted areola, the rooting reflex and the breast crawl of the infant tells us infant knows what they need to do, because there is an implicit capacity plus a very well developed limbic system where the emotions are formed in the infant. So, as soon as the infant is born, if the infant is placed upon the mother's chest, the infant does try to crawl towards the breast of the mother. Or some babies are born with sucking their own thumb. So, they already have learned as soon as they come out to root, suck, and swallow reflex. So there is a time of adaptation, physical environment, barometric pressure differences are there. The baby who has been at 98.4 degrees inside the mother's womb now is exposed to the cold and everything. You can give kangaroo contact or a touch where the infant does get heated up with the mother's body, but then we need to keep them warm, and the 65% of body surface area is in the scalp, and so we always in the nursery put a little cap for the infant. Everybody has seen that. So what are some of these behaviors that bother the parents, and if they are not discussed prenatally, that the parents are not prepared for? First thing is, every parent need to understand that this adaptation does take almost 10 weeks, 8 to 10 weeks. During that time, parents have to adapt to the behavior of the normal newborn behavior of the infant. Be very supportive while they are giving the social emotional support with responsive caregiving, building up the bonding, helping the infant develop attachment and safety and security from the adult caregivers, and almost always, until the infant is taught how to redirect themselves, the buffer for infant's distress is the parent or the adult caregiver. And we ideally want both mother and father to take care of the infant. If there are grandparents, help the parents have their routines, laundering or food preparations, or handing over the baby or throwing away the diapers, because there's so totally that kind of a support is required by the adult caregivers who have come to help the new parents. But infants do not have a circadian rhythm. They don't know this is nighttime, I should sleep with my mom and dad want to sleep. Everything is dark, and they came from the dark world, everything is bright for them, but they don't know this is dark at nighttime, I should sleep. That circadian rhythm is automatically established when the melatonin formation becomes more available from the pineal glands, and that comes after a consistency in structure and routines that are established by the parents for this infant, because that structure and that routine and that consistency gives adequate support for the infant to feel secure. So, we're going to talk about what are the normal newborn behaviors, why they are normal newborn behaviors, and what parents should do to support the social emotional development, while they are also offering language through talking to them by labeling objects and communicating with them and touching them. Visual, auditory, kinesthetics, and touch are very, very important. What I call it as a WACT. And this is intimately related to early relational health, forming robust bonding and pathways that are lifetime, because there was nothing in the baby's brain prior to that. First, every experience, every event is a first time event, and reiteration really makes them connect very well. So let's talk about some of the normal implicit capacities. We might think infants just sleep and they feed, they poop, they need diaper change, they need to be healthy, they need to be bathed and put back to sleep. Yes, they do sleep 20 hours per day when they're newborn, but there is a moment among the six states: drowsiness, deep sleep, rapid eye movement sleep, active alert stage when the baby is alert and kicking to looking around and randomly and kicking arms and legs. They communicate through their arms and legs movement actually with their excitement. And then there is a quiet alert state, and there is a distress alert state when the baby doesn't know how to control itself. And once it is allowed to happen, they don't have the frontal lobe here to control their emotions. So we need to be cognizant about this normal states of mind of the infant, and they are very well developed in their emotional mind, that they have love, sympathy, empathy, and they're born to be social beings. They always look for an adult caregiver to talk to them, handle them, pay attention to them. And they have mirror cells that imitate our body gestures, our movement, and they're very capable of reading the lips, so that they know from the facial gestures and the body movement, body language, if somebody is intentionally being close to them, or they're just being routine and at the same time vexed at the same time because they're not having a comfortable first 10 weeks of life, because they're struggling with the sleep. They're very much aware of that. Their natural state is that of love, sympathy, empathy, and wanting to socialize with the objects and with the people around them, and they're very much aware of the objects. And a 7 to 2 week old baby might even know the plastics feel different than the touch of the mother or a father, warm palms laid on them, and with what pressure they are laid on them. So these are called implicit learning capabilities. And as the infant is into the second, third, fourth week, they know about numeracy. They do know about the feelings and intentions of the adults around them. They do know if somebody is frowning and are vexed against the duty that they are doing. They also do know if there is a warm, tender, loving care. So, having said this, most common thing is sleep. Parents want to sleep through the night. They think, we fed the baby, and the cortisol levels naturally available get lower and lower by the end of the day. And so, and the baby is more distressed, and they like the touch and the warmth and the scent of the parent that they came from. So they almost always try to calm down when mother is making a connection with the communication, verbal communication. They try to be cuddled and lie down on the shoulder of the mother because they feel the warmth and the scent of the mother. They realize they're like little puppies. And that's one of the reasons the kangaroo touch, the kangaroo skin care by the mother is very important. And we want father to have a role also, because we do realize that the emotional quotient as well as intelligent quotient of the uh, future child is better when both parents are equally involved with a tender loving care. So Let the infant cry for 30 seconds, and then there is a demand. Go give the gratification of hugging the infant, let the infant feel the scent, and do a gentle massage in the back. They immediately calm down. Never try to do this up and down shaking of the baby to calm them down. That is very wrong, because that is going to break the blood vessels, because there is a lot of fluid. Brain is a hot zone. There are a lot of capillaries, but there is a connective tissue that's not very well formed. There are 20 trillion cells. But brain is bunch of cells, and it is trying to make connections, and these connections are about 3 million connections a second, 250 times 10,000 synaptic proliferations every minute. So this happens in milliseconds. So as long as the mom is very calm, not tensed up, that they can realize the tension of the mother's hands, gently holding and rubbing the back, buttocks up towards the shoulders, immediately calms the infant down. Now, the baby is laid back down, and the baby cries again because the baby is so insecure, wants to go back to the womb. So instead of that, if both parents are exhausted, take a hand, use a help, but go into a dark, quiet room, fill up a warm water bottle, one of those heating pads kind of thing, and dress up the baby, put the baby face down or on the tummy, but the not smothering the nose in the face to the side, and gently rub the back, leave a white noise or a soothing music, or if some others can sing their own voice, and whatever the stories and the songs the infant heard in the womb will always calm them down. But the most important thing is the self care of the parents. Both of them need to do deep breathing exercise, like a take deep breath in for 6 seconds only through the nose, hold it for 6 seconds, exhale through the nose. And this almost stimulates the oxytocin, and that releases, that kind of blocks actually the stress hormones, tension of the hormones. The tension is increased tone is because of the epinephrine and cortisol. This would internally relax the mother. As long as the breastfeeding is going on, that oxytocin also calms the baby down, calms the mother down, and it's good for in many, many ways to protect against infections and so on. So, this crying is not pain, this crying is not gas. Yes, if the baby cries a lot, we haven't done anything to give the stress relief. The baby swallows air, and then there could be a lot of gases. I like tummy times because when you put a heating pad underneath the infant, the gases come up, and that's very soothing for the baby, and also feels like it's the womb of the mother. Besides the kangaroo touch and skin to skin contact and breastfeeding. So, if this is not helping, understand if mother is given 6 cups of milk, understand that the milk production is a hormone related in a state of relaxation. If a cow eats a blade of grass and gives a liter of milk, does not need 6 cups of milk to make milk production. That's a wrong thing to do. Hydration is important. There are so many oxytocin producing galactagogues. These are like turmeric, ginger root, garlic, drumstick leaves or moringa leaves, moringa flower, um, raw Thai papaya salad, like the white papayas, suran root that's available in Indian grocery stores, and Dill seeds and fennel seeds, boil them and drink the tea. That's what you get in the packages that you buy at the stores, is the fennel seed tea. So these could be the only thing, but mostly internal relaxation and understanding baby is the best breast pump, and putting the infant to 10 minutes on each side when the colostrum is coming every 2 hours, spreading the colostrum itself or lanolin cream on the breast and areola, and just wipe gently off before nursing the infant again. And by the third day, there will be some tenderness and accumulation of lactation coming up. The breast is getting filled up. There will be a little feverishness. That is the time one side where the infant starts feeding should be 15 to 20 minutes, and the other side at least 5 to 10 minutes. Leave a marker on the side that was left off, because we could be thinking, oh, we are going to remember it, and nobody remembers because there are many sleepless nights a parent has to go through. Leave safety pin on the bra or a bracelet on that side. Start 15 to 20 minutes next feeding time, 5 to 10 minutes on the other. This way infant gets the fat and protein rather than just the sugar from the full milk and the minerals, and that will hold the infant longer, and babies become expert in getting it all within 5 minutes on one side, 2 minutes on the other, with this kind of a persistent pattern, and with the galactococs and the internal relaxation of the mother, baby is getting the best nutrition on earth, which is stem cells are there that will help all the organogenesis, immune system, copro antibodies protecting the intestinal lining layer against invasion with the various viruses. We live in a germ prone environment, 84,000 germ viruses floating around us, and every breath we are taking those internally. And besides the maternal passive antibodies that last in the mother's blood system that was given into the infant, lasts about 6 months, and by 9 months it's zero, and that's when they're more prone for infections. We'll talk about it when we talk about the 9 month development and so on. Having said this, colic is not a pain. Colic is a misinterpretation of a communication cry. Crying is communication. Be rest assured, every time the infant is crying, getting rid of the fluid that was in the lungs. That happens within the first 24 hours. And after that, there is a demand. Gratify the demand after 30 seconds or 45 seconds of cry. So there is a sense of belongingness, that my mother and father are changing my diaper. They hear me cry, and I have the warmth, I have the smell, I have the scent, and they're talking to me. And they're talking to me with a smiley face, in a relaxed way, in a loving way. This is what is important in the neuroplasticity of belongingness, attachment, early relational health. That's sometimes very challenging when parents are tired and not prepared for this normal newborn behavior. And another thing is, every time infant is fed, they hiccup, and that's because they're actually abdominal breathers. They're not chest breathers. And the diaphragm goes into a spasm when the stomach gets filled up. And that goes away when the infant sleeps. Nothing needs to be done about that. And that's so normal. Infants sneeze a lot. Imagine we are getting it colonized with the mastocytes, histiocytes, eosinophils, WBC, lymphocytes into the nose to tackle everything that they are breathing, and that does cause sneezing. And those are the chemical reactions, chemical mediators. I did not document that by study, but it is a natural process. As a result of that, you can see some accumulation of nasal stuffiness or plugs. Infants do not know how to breathe through their mouth. when you see a speck of mucus that formed and is in there, baby can turn dusky around the lips. You take normal saline bottle, use a bulb syringe, put normal saline into the nose, and immediately suction all that mucus out.